long video on how to use the UV comb as part of your light therapy treatment in treating psoriasis, eczema or vitiligo. I used to live in South Africa many years, and when I came to Britain my first year, I was covered in eczema. At the time I didn't know what it was. It was on my back, my arms, legs, and I went to see the dermatologist, and he gave me some ointments and creams for it and said it was basically because I'm coming from a nice sunny climate and then coming to the darker climate when there's less sunshine, and I wasn't getting basically enough vitamin D. As the vitamin D deficiency in general that may lead to eczema or psoriasis, as the effect of the UVB rays from the sun on the lipids in the skin that produce the vitamin D that the body requires. And so I used the ointments and creams, but what I found with the ointments and creams is that it never really took away the marks. I was left with marks all over my skin, and I had to keep applying it quite frequently. It wasn't until I discovered the UV light that I was able to effectively treat my psoriasis or eczema, and now just whenever I get a flare-up between November and February, I just top it up, and then it goes away quite quickly. When I initially used it, it took a couple of weeks before the marks started to disappear. And even within the first week, I noticed a difference in applying the light therapy. So what I'll show you how to use it. And to start off with, there are, because we're using ultraviolet light, there are a number of precautions you need to take. And before going further the video, this is purely for information purposes only, and before you start treatment, ideally you should seek advice from your physician. So the number of precautions you require is to have gloves. The gloves don't come with the light, so you need to supply your own gloves. And you get the timer to time it, your UV goggles, and you'll get a operation instructions manual, your comb, UV comb, and all comes in a nice little case. To start with, what you need to do is just switch it on, and the hand that you hold the light with, you put the glove on. Switch it on. It's a good idea just to leave it on, let it warm up for a minute or so. Put your goggles on. And then what you do is it's recommended to build up to about a maximum of 4 minutes per affected area, starting with around 15 seconds, and then you would do it every other day. And on the days that you do it, because you're exposing yourself to UV light, to limit the amount of time you spend outside in the sun. Also, the bulb's good for about 400 hours. Once you've done more than 400 hours, it loses its strength. So it's advisable to change the bulb after 400 hours of use. So what you do is, you'll notice you've got a comb. The comb gives the correct distance between the light and your skin. You just set your timer, and then shine the light on the affected area, going up and down. So starting with 15 seconds, and then you build that up gradually to about maximum 4 minutes. My personal experience is that I didn't require to go beyond 2 minutes, as 2 minutes seemed to be plenty for me. And once you've done that area, that you would then progress to other parts of your body. And then when you want to change over to the other side, what you do is just take your glove off, change your hands, and then treat the other side. It's also after use, your comb may pick up some dead skin cells and things, so it's probably a good idea to wipe the comb down between use and keep it clean. So that's how to use a UV comb in treating your psoriasis, eczema, or vitiligo as part of your light therapy treatment. If you're interested in finding out more information, you can go to our website at bodysculptinguk.com. I have a blog post that I wrote on this subject, and you can also purchase it from our site. We also have an Amazon store that you can purchase the product on our shop. So I hope you enjoyed this video and that you may benefit from the UV light as much as I have. Thank you for watching.